Elon Musk calls Social Security the biggest Ponzi scheme ever. And the former commissioner of Social Security is saying that this is a pretext. Musk is laying the groundwork to cut Social Security. Here is Fortune magazine talking about this big breaking news. Elon Musk calls Social Security the biggest Ponzi scheme of all time as calls mount to remove contribution caps for billionaires. So this all started because there's been a big push to get billionaires to pay their fair share of Social Security benefits, because currently somebody like Elon Musk only pays Social Security taxes on $176,100 a year. That is like pocket change for him. And so there's been this call that anybody making more than 176,100 should pay Social Security taxes so that more money will go into the Social Security bucket. Well, Elon responds to say that Social Security is the biggest Ponzi scheme of all time, and he doesn't think that the program is viable. That drew a big rebuke from Bernie Sanders on NBC Meet the Press. He says Elon Musk's agenda with Social Security is to sow mistrust about Social Security as a pretext, basically as a way to argue for unpopular cuts that Elon Musk wants to do with Social Security. Now, what does this mean and what is going on? Well, Elon has clearly targeted Social Security, and him saying that this is a Ponzi scheme looks like he's laying the groundwork for something bigger other than fraud and waste. And if you stay till the end of this video, President Trump is cutting Medicaid, an important program that serves 80 million people in this country. I am going to bring you the details about these drastic cuts that are going to affect seniors and children and veterans. So if you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update, anything in and out of Congress that's going to affect your Social Security, Medicare, Medicaid, food stamps, and more. But before we get started, as I always do in my broadcast, I want to know where you're watching this from. Go into the comments. Let me know your city and state. We like to know where our viewers are coming from. Now, when Elon Musk said Social Security is the biggest Ponzi scheme, the immediate past commissioner of the Social Security Administration, Martin O'Malley, said that Social Security has never missed a payment, but when he's watching what Doge is doing with Social Security, he thinks that they're going to break the system and Social Security is going to start missing payments in the next 30 to 90 days. So this is serious stuff. So I dug in to look at, okay, what is happening here? Why is this becoming a top issue? Because President Trump has said that Doge is not going to tax Social Security, but Doge is trying to get $2 trillion in savings. And a lot of people have argued that there is absolutely no way for Elon Musk and his group to get $2 trillion in savings from the federal government without touching Social Security, Medicare, and Medicaid. So when Elon goes on camera and says Social Security is the biggest Ponzi scheme and that he doesn't think the program is viable, it lends credence to the fact that he's planning something bigger and that this is cover, or this is the pretext to be able to then cut Social Security benefits or turn it into something else because he doesn't think it's a viable program as it is. So let's dig in. Former Social Security Commissioner Martin O'Malley warns that monthly benefits for 72 million people are at risk due to Doge's actions, and he predicts that payment interruption would happen within 30 to 90 days. Social Security has never missed a payment. It is over 80-year history. Nothing like this has happened, but because of what Doge is doing with the Social Security systems, O'Malley believes strongly that they are going to break the system and cause delays in your payments. The Department of Government Efficiency, led by Elon, has initiated significant changes at Social Security Administration. These changes are part of the Trump administration's broader efforts to reduce government spending and workforce. And O'Malley advises that people should start saving now And what he means is that seniors who are on Social Security watching all this happen should start saving now ahead of any potential interruptions in benefits. This suggestion indicates the seriousness of the situation for those who rely on Social Security as their primary source of income. The Social Security Administration, people in the administration, has been pushing back. The Social Security Administration is experiencing unprecedented leadership upheaval with multiple high-ranking officials leaving. Acting Commissioner Michelle Kane recently resigned following reported disagreement over DOJ's access to sensitive Social Security data. And then Lee Dudek has been appointed as the acting commissioner, while Trump's new Social Security head gets Senate confirmation. And Dudek was previously placed on administrative leave for helping Doge. Now, Senator Elizabeth Warren has highlighted a LinkedIn post that shows that Dudek bullied agency executives to help Doge in the past. And there's 24 senior staff from Social Security, part of the brain trust of this important institution, that have left recently because of disagreements with Doge. So what is happening with the Social Security Administration that Martin O'Malley feels that is going to break the system and cause delay in benefits? Well, the first thing is that there's been a massive cut in staff. Social Security is already understaffed, and the administration announced plans to cut 7,000 jobs, representing 12% of its workforce. Some reports suggest that the workforce reduction could eventually be as high as 50%. What does this mean if you are on Social Security or disability benefits? Well, Social Security is already at a record low when it comes to staffing. In the meantime, there is a record high in the number of people getting benefits. So we have a record number of people getting Social Security disability benefits, and we have a staffing shortage that is about to get worse. And so what does that mean for your benefits? Well, they are closing offices and they are terminating leases for several offices. So what it means is that in certain areas, especially rural areas, it's going to be very hard for you to get somebody on the phone at the local office, or even have an office closer to you that you can access if you need help. And if you're on disability benefits, the hearing sites where you go and get your disability hearings, they are closing a lot of these sites to save money. And this is going to mean that people who are applying for disability benefits are going to be in a very difficult situation and have to travel further to find a Social Security office where you can have your disability hearing with a judge or with a Social Security staff. Here are some of the offices that were announced recently that's going to be shutting down in New York, West Virginia, California, North Carolina, Arkansas, Ohio, Michigan, Texas, Wisconsin, and Nevada. So what is going to happen? What should you expect now that these drastic changes are happening with Social Security? Well, the first thing is that there's going to be longer wait times. Currently, the average processing time for Social Security and disability is increasing, has doubled. So if you are applying for disability benefits, it's taking up to 231 days, over 6 months, for that to be processed. And because of the staffing reductions, that is even going to get worse. If you are claiming Social Security for the first time, you're probably going to have to wait for a little bit, because this has to be processed manually by a staff person, and now they are short-staffed. It's going to take longer to get your initial Social Security benefits approved. If you need documentation from the Social Security Administration to verify your income, to verify your benefits, that also has to be processed by a Social Security employee. That is also going to get harder. And finally, there's going to be payment errors. Already, because of the short staff of the Social Security Administration, there is growing incidence of overpayment. If you've watched the news lately, a lot of people on Social Security and disability are being hit with overpayment, where Social Security, after months or years later, is coming to them and telling them, you owe us money. We have paid you more benefits than you were eligible for, and now we are going to pause your benefits, or we're going to cut your benefits and use that money to pay back what we think you owe us until it's all paid off. Over 1 million people a year are facing Social Security overpayments. That is about to get worse as staff shortages delay processing of paperwork and get a lot of people caught up in Social Security overpayment issues. Now, Doge says they're trying to get $2 trillion. Well, the thing is that they claim that Social Security is fraudulent. There are people 150-year-old claiming benefits. They haven't provided any benefits. The Social Security Inspector General said between 2015 and 2022, they did an investigation and only found 1% fraud. And even that, it was because people were paid more benefits in overpayment than they deserve. So to claim that there is hundreds of billions of dollars in fraud in Social Security and not providing evidence, it's going to be a challenge for Doge. And my thought, and this is backed up by a lot of experts, is that it is going to be impossible for Elon to get $2 trillion out of the government when Social Security, Medicare, and Medicaid are 42% of the government spending, and he's trying to get 2 trillion. There is no way you can get 2 trillion if you're not going to touch defense spending without gutting Social Security, Medicare, and Medicaid. There is absolutely no way. So $2 trillion in savings does not exist if you're not willing to touch Social Security, Medicare, Medicaid, and defense spending. There isn't just enough money in the system to do that. So now that Elon is saying that Social Security is a Ponzi scheme, it makes me believe that this is just the groundwork. He's laying the groundwork to argue that Social Security should not exist in its current form, because he said that Social Security in its current form, this is his own words, is going to fail because it's not going to be able to pay benefits in the future. And so I am thinking that this is just preparing us all for what is coming, which is that they're going to claim that Social Security is not viable in its current form and something has to be done to it. So stay tuned for that. We will all be watching. But here's the thing. There's potential consequences. Martin O'Malley is warning that Doge is breaking so much in Social Security Administration that there's going to be payment delays in 30 to 90 days. This is directly from the immediate past commissioner. It could cause financial hardship. And then there's going to be service reduction, which is going to cause delays if you want to access Social Security staff. And then there's going to be record maintenance. So if you are collecting Social Security, you may want to go online and print your records, your Social Security record, so that if there is something happens, if they break the system and all of a sudden they come and say things are wiped off or things have been destroyed unintentionally, or your payment is adjusted for whatever reason because they don't think you should be getting what you're getting, you can take your payment history, how much money you've contributed into the Social Security system. There's a record in your profile when you log in online. You can print that out and keep it just in case, because what is happening now is very scary. We have no idea what they're doing in there. And, when they have 19-year-olds, 20-year-olds playing with big, big trillion-dollar systems, I am not confident that nothing is going to go wrong. And Elon Musk has already said that they're going to make mistakes, and he's owning up to that. But I don't want my Social Security benefits to be part of that mistake. So print your records now and hold it just in case. Now, so basically, what can you do? Well, contact your representative, contact your senator, contact your congressperson, and let them know that you don't want Social Security to be touched. And even though the president is saying they're not going to do that, I am telling you that experts are saying that there is no way to cut $2 trillion from the government without touching Social Security, Medicare, and Medicaid. Think about it. If 40%, 42% of the entire government spending is Social Security, Medicare, and Medicaid, and then defense is next, and they're not going to touch defense spending, Where are they going to get the money from? There is no way they're going to find $2 trillion without gutting Social Security, Medicaid, and Medicare. So let me hear from you. I mean, this is all public information. Elon Musk did say that Social Security is a Ponzi scheme. He just said that recently. You can Google it and find out when he said that and what he said about it. He did say that he doesn't think the program is viable in the long term. So what does that mean? When he says it's not viable, it means that he's going to try and do something about it. What do you think he's going to do? Do you think he's just going to leave it alone? I don't think so. I think that this is just preparing us all for something that is coming. Now, before we talk about Medicaid, which there's a big news coming up, the House of Representatives passed a bill to gut Medicaid by $880 billion. I have that for you. Let's talk about Medicare, for example. So over the last month, I've been talking about Medicare, and a lot of you have been sharing your stories about your frustrations with your Medicare plan. And so I have partnered with Chapter Medicare to help you. There are 3 reasons why I did this. The first is that Chapter is the only Medicare advisory company that offers a free service that also only have access to the 24,000 Medicare plans out there. 90% of seniors are in the wrong Medicare plan. Part of the reason is that there's 24,000 Medicare plans out there, and Chapter is the only organization that has access to all of it. The second reason is that their agents do not work for commission. So when you talk to them, they are not getting on the phone to sell you the highest commission plan. They are there to help you find a plan that fits your budget and fits the coverage that you're looking for. And then finally, they can save you up to $1,100. So call the number on the screen, 539-205-2147, or you can go into the description to this video. There is a form you can fill out, and you have to do it now because the open enrollment for Medicare Advantage ends March 31st. Then you have to wait all the way to the fall before this opens up again. So act now if you want to get into the right plan. So let's talk about Medicare. Now, President Trump is supporting a House bill that is going to gut Medicaid. And this is devastating for a lot of reasons. So let's talk about it. Here is CNN. What is Medicaid and why is it a Republican target for cuts? And this was a few days ago. Well, what is Medicaid? Medicaid is a government program in the United States that provides health insurance for adults and children with limited income and resources. It is a joint program between the federal government and the state government. It is funded primarily by the federal and state governments. As of 2022, there are 85 million people that are on Medicaid, including low income and disabled people. And eligibility rules vary, but for the most part, if you make less than 138% of the federal poverty line, you qualify for Medicaid under the Affordable Care Act. Now, what are the key features? Well, Medicaid covers a wide range of services, including benefits like inpatient and outpatient hospital services, physician services, and lab and x-rays and etc. It costs about $870 billion a year. That's what I told you. It is the 3rd biggest line on the federal budget. So if they gut Medicaid, who is going to be impacted? Well, over 40% of all children in the U.S. are covered by Medicaid and CHIP. This means that a lot of children are going to lose benefits. Low-income adults. Medicaid covers millions of low-income adults who will otherwise be uninsured, including parents and adults without dependent children. Seniors. About 12 million seniors are dual eligible for Medicaid and Medicare. And so they are also going to feel the pinch. Why? Because for those seniors, Medicaid pays for their Medicare premiums, out-of-pocket costs, and other services not provided by Medicare. People with disabilities, about 10 million enrollees qualify for benefits because of disability. And here is a big one. 1 in 2 births in the United States, 1 in 2 children that are born in the U.S. are covered by Medicaid. Special needs children are covered by Medicaid. A large number of special needs children rely on Medicaid. Home-based community services, over 3 million people receive long-term services and support through Medicaid. And then mental health and substance abuse is also facilitated a lot through Medicaid. So who will be affected? Well, 40 to 50% is going to be hitting children because 1 in 2 births are covered by Medicaid. So approximately 40 to 45% of Medicare recipients are children, representing 30 million young Americans, and they are going to be impacted. Medicaid is the primary payer. Here's a big one. 62% of nursing home care is paid for by Medicaid. So seniors are going to be impacted. Working families are going to be impacted. And rural, the most devastating part of the Medicaid cuts is rural communities. Rural hospitals and healthcare facilities rely heavily on Medicaid reimbursement to remain operational. These cuts are going to impact them a lot. I talked about dual eligible seniors who rely on Medicaid to pay for their premiums, deductibles, and they are also going to be impacted. And then supplemental coverage through Medicare Advantage is also going to be gutted, and it's going to push a lot of seniors into debt. Now, this bill, this budget process has passed the House, is moving to the Senate. They only need a majority vote. They don't need 60 votes to pass this. The Democrats would have been able to block it. They only need a majority in the Senate because they're using a process called reconciliation, which means that they have the votes to pass it. So if you want to get your voices heard, this is the time to make your voices heard, because this train is moving and they're going to gut $880 billion from Medicaid, and it's going to hurt a lot of people. So the Republicans have the House, the Senate, and so they can do whatever they want. They have the presidency. So if they want to run this through, they've already jammed it through the House, and all the Republicans in the House voted for it. So they're going to go to the Senate and do the same thing. This is your window to say something about this. And you can call your representative, call Congress at 202-224-3121 if you want to get your voice heard. Because sometimes these things happen because not enough people speak up. And if you look at the chart on the table right now, they want to cut $230 billion from SNAP. And then they want to cut $880 billion from Medicaid for a total of $1.1 trillion. And this, why are they doing this? Because they want to give tax cuts that primarily benefits the top 1% of the population. So they're gutting programs for low-income people in order to finance a $4.7 trillion tax cuts that primarily benefits the rich. So what are the 10 groups of people that are going to be affected by this? Well, the first one is Medicare dual eligibles. If you're on Medicare and Medicaid, you're going to have loss of coverage for services that Medicare doesn't cover and reduce access to dual advantage Medicare plans. Nursing home residents, 62% of all nursing home residents are paid for by Medicaid. They're going to be impacted because stricter eligibility requirements will force more middle-class families to exhaust their savings before qualifying for Medicaid. Home health care recipients, if you're somebody that want to age in place, if you're a senior that doesn't want to go to a facility, you want to age in place in your own house, and you need a home health aide to come in and help you, but you're on low income and you cannot afford it, Medicaid is the program that pays for that. Well, now that they're gutting the program, there's a wait list for these services, which is years long in many states. That is even going to grow substantially. Rural communities, there's already 600 rural hospitals that are at risk. With these cuts in Medicaid, it's going to impact them because a lot of rural hospitals rely on Medicaid to stay afloat because most of their customers are on Medicaid. So when the cuts happen and they are not getting the money that they expect a lot of rural hospitals to close. Children with special needs, there are 14 million children with special needs that are on Medicaid. They are going to be impacted. So early intervention services for developmental delays will be reduced or eliminated. Families caring for medically complex children will face devastating financial consequences. Pregnant women, as I mentioned, 1 in 2 births in the United States are covered by Medicaid. So obviously, this is going to have an impact. Mental health services. Medicaid covers a lot of mental health support. Community mental health centers and wait times for psychiatric care would increase dramatically. Working adults who need medical care, who cannot afford their own health insurance because their job does not provide health insurance, are also going to face serious cuts. Veterans. Not all veterans qualify for VA healthcare, making Medicaid essential for many veterans. Approximately 1.7 million veterans rely on Medicaid for their healthcare. They are also going to face devastating cuts. Mental health services, crucial for veterans with PTSD, is going to be harder to obtain. And then even people in the healthcare industry who work in jobs that don't pay a lot of money, so they cannot afford to buy healthcare on their own, rely on Medicaid, and they are going to be impacted as well. So Medicaid is on the chopping block. 82 million people depend on it. And now they're targeting it in a very big way. So let me know what you think. Are you on Medicaid? Do you know somebody that's on Medicaid? Do you know somebody in your family who is a veteran, who is disabled, special needs, children that are going to be impacted by this? And if you want to do something, this is your window to call your representative and let them know that cutting Medicaid is not okay, because this is not some pie in the sky idea. This is not some vision that they have. This is actually happening. They've passed the budget resolution in the House. It's going to move to the Senate, and then it's going to go to the president. So these things are in motion. If they tell you they are not getting Medicaid, just watch the news, do your own research. Whatever news source you think is credible, go to the House of Representative website. It's all there on their own website, telling you they want to take to 880 billion from the Energy and Commerce Committee, which is the committee in the House that is in charge of Medicaid. So don't let them fool you to window dress something for you. This is their plan, and they're executing on it. So thank you for hanging out with me today, and I'll see you tomorrow in my next live. Thanks.